Hey guys, welcome back to the Pulling Curls podcast. Today on episode 99, we're talking about leakages. Not from your faucet, not from your bosoms. It's from the downtown. Let's untangle it. Welcome to the Pulling Curls podcast. I'm Hillary, your curly-headed host on the podcast where we untangle everything from pregnancy, parenting, and home routines. I want you to know that there are no right answers for every family, and I find that simplifying my priorities is almost always the answer. It's tangled, just like my hair. Okay, guys, before we get started, just a reminder to leave me a review. Busy moms don't have time to leave a review, but I know you do, right? Reviews mean so much, you have no idea. Thanks for leaving them. We really appreciate it. Okay, guys, today's guest has a Doctorate of Physical Therapy. She has all the initials. You know, I love initials some of the time. She's board certified in women's health specialty. She loves educating moms about how physical therapy can help them, especially with vaginismus. If you don't know what that is, you can Google it. It's more common than you would think. And I actually found her on TikTok. She is the first person that I was like, I need to have her on the podcast. I just think this is something women, pregnant women, women who have pee in their bladders need to learn about. She is on Instagram at Ashlie Crewe Campitella. I'll have the links in the show notes. She's also on the TikTok. We play a little game towards the end called Is This Normal? And I have to tell you that most of my friends think all those things are very normal. And while they're very common, they're not normal. So I want to introduce today's guest, Ashlie Crewe. Are you overwhelmed by all there is to do around your house? As a new mom, I felt overwhelmed at every turn. Fortunately, I turned to systems to make a change. Whether it's mornings, dinner time, or even just to climb out of a pile of kids' clothes, my course Family Routines can save you. I hold your hand as we smooth out these rough patches, making every day easier so we can more easily handle when your preschooler tells you they can use their urine like a lightsaber. Parenting is always going to be a wild ride. Routines are just your seatbelt, and they can support you. Use coupon code UNTANGLED to save 15% at checkout. Link in the show notes. Hey, Ashlie, welcome to the Pulling Curls podcast.
Thank you so much for having me.
Yeah, I love having experts on, obviously. I love people with initials behind their name.
I hope to not let you down then.
Believe me, I have been let down many times by many initials.
I can believe that.
Okay, so you are an expert in all things pelvic floor, right?
I sure hope so. We're about to find out.
As expert as you can be, because everybody's is different.
Yes, that's the truth.
I mean, I have felt a lot of pelvic floors in my time.
Absolutely, as have I. And everyone's a little different.
So what causes bladder leakage? I think a lot of people think it's just pregnancy, but there's plenty of women who have had no children or have had C-sections who still end up with bladder leakage. So what are the main causes?
Yeah, absolutely. So the main cause, the most common cause that I would say we typically see is weakness or a lack of coordination of the pelvic floor muscles. And so for a lot of folks, that can happen after a pregnancy because those muscles experience a lot of stress during a pregnancy period, not necessarily dependent upon exit strategy of said baby. But so there's a lot of changes that those muscles have to undergo during pregnancy. But just for a lot of folks, we're not necessarily spending a lot of time being told about, strengthening those muscles. And then a lot of times what happens is as we go through the aging process and maybe our hormones change a little bit, there's actually less blood supply to the pelvic floor muscles as we have a little bit less estrogen in our system. And so that's really when I see a significant increase in symptoms of leakage. Whereas, maybe in our 20s and 30s, we're having babies and we recover really well. But then as we're in our 50s, 60s and beyond, and we have some less estrogen there, those muscles aren't getting the same amount of blood flow. And so they get to atrophy even a little bit more. So that's when we start to kind of uncover some dysfunction that's potentially been there for 30 years.
Oh man, that means it's only going to get worse.
That's so what I'm saying now is if you are in your 20s, 30s, 40s, and 50s, if you're not postmenopausal, you can be doing some things prophylactically to improve your odds. But yes, things certainly will almost positively or almost definitely change as you get into your menopausal years. So prevention.
Okay, so what can we be doing to help it?
Yeah. So obviously, I am who I am. I do what I do for a living. So I will sit here and preach. We all need to be doing a really great pelvic floor exercise program, or let me qualify that by to say an exercise program that includes attention to our pelvic floor muscles. Because I think that's one of the things that I hear a lot from folks is that they like, do I have to spend an hour a day just doing Kegels? And I'm like, no, that's crap. Like, there's no way. Like, I expect anyone to do that. I don't do that. But really what I want people to do is to start focusing on some basics of pelvic floor contractions in their younger years. And then just like we would with any sense of, anytime we have any injury in a muscle group, if we do go through a pregnancy or something that impacts those muscles, you might need some focused attention on those muscles right afterwards. And then can kind of sort of scale down to a maintenance exercise program now. And so it's way more than just Kegels. I think that's the other thing I hear so often when it comes to like, what do I do for a living is it's just Kegels. And I'm like, why do I have a doctorate degree and like all this advanced training if it was just a pamphlet saying like squeeze? So, a really brilliantly performed Kegel is sort of the foundation of everything else that I teach my patients. So I tell people like that's day one for me. And then we continue to like integrate it into things like squats and picking up your kid and getting the godforsaken car seat in the car and, doing all these functional things that maybe we're going to use that Kegel as a foundation of, but certainly, laying on your back or sitting in your car at a stoplight squeezing these muscles is not necessarily going to do a great job at preparing you for things like lifting up kids and, loading your dishwasher. So I really encourage people to, it's best obviously to kind of meet with somebody who's got some training and can look at each individual person. But for lots of people, I say, we can certainly be seeing lots of benefit by just kind of incorporating some Kegel contractions into things like, bicep curls. If you're doing that at the gym and trying to contract these muscles while you're doing these bicep curls, just simple things like that can make a difference.
Oh, interesting. Yeah, I've noticed that going upstairs is like my arch nemesis with the Kegel. So, and that's like not anything I had really thought of until I was either, I think it was the Perry Fit I was doing when they were like, don't just do it laying down, do it standing up or whatever. And I was like, standing up? That's too hard.
Right, exactly. And that's why I tell people like, there's no one exercise program because somebody else could take that Perry Fit and do it standing up, no problem. And so like, that's why I really encourage folks, like you gotta, at least for starters, see somebody who can scale your exercise program up or down, depending on whatever your pelvic floor muscles are capable of at any given moment.
Right. Okay. So I saw, so my youngest is 11 and I got sent to physical therapy after she was born. And it was one of the worst experiences of my life just because she was super awkward and made it really awkward and it never really fixed something. And I finally was just like, this is hurting me ultimately more than it was helping. So how do we find someone that's cause she had all of these like degrees and she kind of knew what she was talking about, but it ultimately, I was just so weird. And if it was weird to me, imagine how weird it was to somebody who doesn't like
right.
touch vagina.
Exactly. Someone with your experience and exposure.
Yeah. So how do we find somebody that can help us? Obviously you have to click with somebody and that's a whole different level, but somebody that can actually help us rather than she just pointed like everything that was wrong. Oh, this is bad. This is bad. And I was like, well, how do I fix it? And she was like, Kegels. And I was like, and I didn't even know I could Kegel walking up the stairs.
Right. This is the way it goes. And I will say, this is so much to do with the way these therapists are trained, myself included. And just a lot of it is about their personality types and truly who you click with, because we all have certain things that we're really fantastic at and the way we explain things to patients. So I really encourage folks there are a couple like online resources they can use to sort of find pelvic PTs or pelvic professionals in their area. So I tell folks to kind of start there and then truly like call and interview them. So the one that I have referenced a lot of times is using www.pelvicrehab.com. And on that site is anyone who's taken at least one course from this company who specializes in pelvic rehab education. So again, that's somebody who's taken one course, not, 7 courses potentially. So, but then it's really going to be important to kind of read that person's bio. But 100%, I encourage folks to call those therapists and just say, hey, I have some questions. Can you talk to me? I will absolutely put myself on this limb and say any therapist worth their paycheck will get on the phone and have a conversation with you for free for 5-10 minutes so that you can see, do I click with this person? Does this person sound like a professional who will help me with my problems? Because just like everything else in healthcare, we have some professionals who are maybe trained. I don't want to talk crap on anybody, but maybe we're trained and haven't gone to any more recent education. And so we're finding things out. Pelvic therapy is such a new field that we're constantly learning more. And so I really encourage folks, you want to ask someone, when's the last time you went to a course, or what are you doing to further your education right now? Because truthfully, I went to my very first pelvic course probably 12 years ago, give or take. And what I do now looks very little like what I was taught 12 years ago, because we just know so much more. And so
and I think that's important for people who have kids like my age, because things have really, 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 really changed since even just 12 years. Now my oldest is 21 and it wasn't even a thing.
No.
Back then. Nobody did that. So
exactly.
She's 11 and it was just starting, but I'm sure that even that lady who's super awkward is even better now.
Yes. Well, Lord, I hope so. And as I'm sure I'm better now. I'm more efficient with my patients. I'm get better results now than I did. We're always, that's why we're practicing medicine, as it's always evolving, and we're hopefully getting better as we're learning more. So yeah, and I think it's something that I struggle with too. I'm in a position now where I'm training other therapists and mentoring other therapists within a company. And so I'm getting therapists who have maybe, been treating for 20 some years, and then they see me come in as a hotshot, new grad, although I've been around for a while too. And here I am saying maybe try this newer idea. And sometimes being met with some resistance for that. But I mean, that's truly a thing that, I encourage people, you just have to do some legwork and call around, and don't be afraid to say this isn't a good fit for me. It sounds like, with your therapist, I tell people, I never want a patient coming to me, feeling icky, feeling like I don't really want to hear what she says. There's somebody better out there for you. I will help you find somebody else. So I really encourage folks, to interview people, and don't be afraid to shop around, because ultimately, we in medicine, we don't want to do harm to our patients. And if you're going to be feeling icky stuff coming to see me, that's doing harm in my book, and I don't want to see you then.
Well, I was with Kaiser, and she was the only one in the local system. So that was the thing. And I'm sure that's going to be the same for a lot of people. You kind of have to go with what your insurance. Do a lot of these people have a cash pay rate?
A lot of people do. So a lot of people who are either in an outpatient PT setting or in a hospital-based setting, a lot of people do accept insurances, but lots of places, if you're not in network with my insurance, we do offer cash pay options. And then I always encourage people, the one maybe good thing that has come with COVID is that physical therapy and occupational therapy via telehealth now. And so, the lovely thing about that is, as long as you're in the same state as your therapist, you can see anybody in the state. And some of the licensures will even let you see therapists in other states than where you are currently located. So this is where I tell people, more than ever before, be choosy.
Okay, now does that matter? Because she was a very hands-on.
Depends on the therapist. So again, if you had asked me 5 years ago, I would be like, ooh, I don't know if I can see patients via telehealth. But I mean, we've certainly evolved. We've definitely grown that skill set. And that's, I have patients who at this stage, I'm thinking of a woman I actually just wrapped up with at 12:30 today. And I have not seen her in person yet, because she lives 3 hours away from me. And she has seen, she was coming to me for postpartum urinary leakage, and she's seen easily 80% improvement with, just some telehealth visits, talking about exercises and integration. So some therapists are, yes, very hands-on. I think the therapists who are really, nailing the telehealth game are therapists who are used to sort of adapting those skills and maybe treating a little bit more hands-off. But I've been seeing really great results with those patients. And the way I always look at it, again, is if it's going to mean you've got to go see a therapist in person who doesn't make you feel good as a person and heard and listened to and motivated, versus, it doesn't matter what that person's going to do with their hands. It doesn't matter, versus if you can see a therapist who you feel like gets you and is your cheerleader and your coach and is going to be with you to troubleshoot, you're going to have a better result no matter what. And so, if I could have my perfect way, yes, I'd love to see patients face to face in the same building so I can put my hands on them. But if that's not a feasible scenario, then I still see lots of great results via telehealth. Better than I ever expected, I'm going to very vulnerably say.
That's awesome though, because also a lot of these people are busy moms who maybe need to shove it in during nap time. And if they can make a huge improvement in their life, either lunchtime if they're working or nap time or whatever, what a benefit that is to them.
Exactly. And I think for me too, because, ultimately it's not always feasible to have like my patient bring the kid into the clinic so I can watch her. Okay, now I need you to feed the baby. I need you to change the baby's diaper so I can watch all of these tasks happen. Let me see you put the baby into the crib. And that's what, I don't get to do that in a normal setting versus now seeing patients via telehealth. Toddler comes over and is pestering mama while I'm trying to work with her. And mom's like, oh my gosh, I have to go change a diaper. Yeah, sure. Take me with you and let me watch. So that I can see, is there things that I can tweak if it's, changing your position or changing the height of a table somewhere. So I really have appreciated all the things. So I have lots of patients who maybe have seen me in person and live locally, but then I will purposely schedule some telehealth sessions so I can see how they interact in their home environment. And to your point, I have two of my own and I'm sitting here if I needed PT, how would I make that happen? I'm a full-time mom. I'm a full-time, physical therapist, but I also have two children and a husband and a house and all these things. When would yes, I would have to do telehealth PT because I don't know when else it would happen. So I think that too, just having us more accessible, because the other big thing is I'm a very big proponent of equity. I want everyone to have access to care. And so I think, if I have a patient who needs to hire a babysitter for 2 hours so she can spend 45 minutes in the clinic with me and then pay me her copay on top of that, that's not necessarily equitable. If I've got another, mom who's got a stellar insurance plan and she's got a $10 copay and grandma's around and aunts around and all these people to help, I'm here to make healthcare for all accessible. So telehealth has been a great option for that as well.
Yeah. So if people maybe are looking for one that's local, are there any great online courses that people could just start with? Have you heard of anything like that?
As far as if they want to just do a pelvic exercise program?
Yeah.
That's a great question. I'm sitting here because I know they're out there and I'm sitting here now do I know the MUTU system? I've heard really good things about, and that is definitely based in evidence. That's MUTU.
Okay.
So that is, I think, if I remember correctly, that is there's a pelvic therapist who worked with some trainers and things like that to develop that system. And at this moment, I can't think of another one. So
yeah, I'm feeling they're super popular, but they tend to, when I've seen them, they tend to concentrate more on abs and they don't talk so much about how you integrate the pelvic floor into the ab thing. And usually it's done by exercise physiologists or just people who like to exercise rather than somebody who really understands how all those muscles tie together along with all the things that moms are doing.
Right. Absolutely. And that's where I think, I would definitely encourage folks to kind of research whatever it is you're trying to think, because they're not always super cheap either. They tend to be, you're going to shell out some money to do this, whatever program. So I would encourage folks to do some research and see, was it developed with somebody with actual pelvic floor training, or is it somebody who watched some YouTube videos about diastasis and said called themselves a postpartum expert? And so I would encourage folks to do some digging to see what information there is out there and is it based in any evidence and research before just hopping on board.
Is diastasis recti tied with pelvic floor dysfunction particularly?
Oh, good question too. So I don't know what the research says is my official statement, but I will say, almost every human who has a baby up to 38 weeks of gestation has some sort of separation in their abdominal wall. And there are definitely some changes that happen to folks' bodies during a pregnancy that, if not corrected, can persist throughout the rest of their life. And because some of the deepest abdominal wall muscles share some connections with some of the pelvic floor muscles, we see diastasis recti and pelvic floor dysfunction hand in hand. They're little evil twins that we see all the time.
And I think a lot of people, I really don't think I had too much diastasis recti with my last one, but there probably was some because I went over 40 weeks. So that's probably just how it goes.
Yeah, I was saying. And the nice thing about it is, the research does show that pretty much everybody 40 weeks pregnant pretty much has some diastasis across the board. But lots of folks, it resolves spontaneously, kind of just fills back in with just normal daily living. But if we've got some other factors at play, then it might not. It might need some encouragement.
I think we should play a quick game called Is This Normal? Are you ready?
Oh, okay. Is this normal or is this common? Which we...
Normal. Well, because I think everybody thinks, here we go. Is it normal to pee when you jump on the trampoline with your kids? Yeah. Because I think a lot of people are A lot of people are like, oh, I just pee when a lot of us do.
Yeah. Oh, yeah. And I've got lots of people who, when I say, like, they won't check the urinary incontinence box on my questionnaires. And then I'll say, but you're here for pelvic floor muscle weakness. Talk to me about that. And they're like, oh, I don't have that incontinence. I just leak when I sneeze. And I'm like, well, that's incontinence. I think a lot of people have this conception that like incontinence is when you just have zero bladder control. And I'm like, no, that little cough leak pairing, that's incontinence too. So
that was my next one. Is it normal to leak when you cough?
No.
Is it normal to leak when you walk up the stairs?
No, it is not, Hillary.
So there's lots of different kinds of incontinence. Do you recommend any of those? So I've done PeriFit and I've done the one where they have the electrodes that you put in. Yeah. Do you recommend any of those? It seems like an actual physical therapist would be better than both of those.
That's my statement. So yes, I've tried the LV and the PeriFit. And so they're truly, and if you dig far enough into any of their materials, it pretty much says they are developed to be used with a professional, not independently. My biggest complaint with them is that they're based on what's called pressure biofeedback. So pressure biofeedback, essentially, you insert this sensor. I'm using my fingers like everyone can see me. Can't not talk with my hands. So you insert the sensor into the vaginal canal, and then you do a pelvic floor contraction or a Kegel. And in theory, the pressure on the little sensor increases as you squeeze. And so it registers, hey, this went up. Congratulations, you're doing this correctly. But the problem can happen is if someone has some pelvic organ prolapse or just some changes in their anatomy, when they contract their pelvic floor muscles appropriately, maybe they're improving their pelvic organ prolapse. So there's less pressure in the vaginal canal. And so this little sensor is saying, hey, there's less pressure. You're doing it wrong. Stop. And so lots of people don't necessarily know they've got a little bit of prolapse until they've been seen by someone who's checking for it. And anyway, so then I've seen people who sit there and try to do all these crazy maneuvers trying to get increased pressure on this little sensor, and then sometimes doing the wrong thing and sometimes with drastic bad consequences. So I really encourage folks, at least go for a one-time check. Like, I'm happy to do that for folks. If they say to me, hey, I live 4 hours away, I'm here for a one-time visit, show me how to use this PeriFit, great, I'm here for that. And then maybe we can do some phone call follow-ups to make sure it's going well. So I would prefer to do it with some PT. Did you have the little thing that like actually did the tingly stuff inside to make your muscles contract?
Oh yeah, baby.
Oh, look at you.
You put on the electrode gel. I have a post on my blog because they sent it to me for a sponsored post. Yeah. So I think that started because I had a 4th degree with my first one. So just everything was like all whackety whack. He's 21 this summer. So I think it did start to like maybe put like synapses together because there were just areas that weren't going. They had no muscle. It'd just be like if you tore a ligament. So I think a lot of times we need to look at it that way instead of just like, what's wrong with my pee hole? Your pee hole has a ligament that's not working. And so I think it did do that, but it's also painful and weird. And I don't think a lot of women would really like it.
Yes. And that's the other part of that is where if you've got no contraction of a muscle of your own volition, if you cannot connect your brain to your body there, then that's the perfect time to use something like that to help those muscles contract so that your brain does say, oh, that's what that muscle does. I remember now. And it can start to form some synapses and connections there. So, but that's the other flip side of that coin. Anytime I'm talking about it with patients, I always say like, listen, we can do this. I'm happy to do this. Like, I want you to be prepared for what to expect here because it's not always super duper comfortable. And so I always tend to say, if I can do some other things with you to try to get those muscles to fire and build those connections, I'm happy to start there. Or if you want to jump right to this, I'm a huge proponent of patient autonomy where I say some patients are like, no, zap me, do it. Like, let's make this happen. And okay, we'll do it. Whereas if I have some patients who are like, I want nothing of the sort, like, great, let's try some other conservative things to try to wake up those muscles and form some connections too.
I probably wouldn't recommend you jumping right to that one. Back to the is it normal game. So is it normal after your first baby for everything to just feel way, way different for an extended period of time?
Not for an extended period of time. I would say,
because I definitely, I could never Kegel again the same way I could before.
Well, girl, you had a 4th degree tear. So No, you should be able to Kegel at some point again. And so I would say by that 6-week postpartum check, or 8-week, just depending on method of exit and, provider preference, you should be able to have some decent connections of, oh, I can feel those muscles contracting. I feel like they're releasing. And that's kind of the cutoff I tell people. Like if in a 6 to 8 week window, your symptoms and your feeling isn't significantly better, same way as we would with any other musculoskeletal injury, would give it a 6 to 8 week healing window and then say okay, where are we at? Are we actually back to normal function, or do we need some assistance getting back there? So
ooh, I like that, because a lot of it is normal. When women stand up the first few times and they start to pee, I'm like, girl, this is not going to be your life.
Absolutely. There is some nerve damage, nerve injury potentially that happens when you push a baby through your vagina. And so those first couple times where those muscles are like, what in the actual, what am I doing? So I tell people that is really, really common. But to your point, that does not last. It should not last. It's not normal for it to last.
Okay, that's good advice. So if you're at your 6-week checkup and things don't feel, I don't know, you're ever going to get that Kegel of a virgin 16-year-old. That's never going to happen again. But you know what I'm saying? When you were 7 months pregnant, you should be back to that
really
Kegel by 6 weeks.
Yes.
Yeah. Okay.
And if you're not, zero shame if you're not, because, everyone heals a little bit differently. And the other big thing we always have to think about too is, so this person's now been sitting on this tissue that they injured for a long period of time because we're feeding our babies, right? We're not necessarily being super active. So you think about any tissue in our body, we tear through a muscle and then we compress it. Right? We put pressure on it, right? And then if that person is lactating, lactation suppresses estrogen to our genitals as well. So it almost creates this pseudo-menopausal effect on our tissues where we don't have as much blood flow to our tissues as well. So we have this little perfect storm to set us up for not great healing in that area where we tear through some things, then we sit on top of it and also have less blood flow systemically to it. So zero shame if you're not back there by 6 weeks.
Yeah, but you can just ask your doctor, I'd like to see a physical therapist. And I don't think most of them refer out very much, do they?
Don't make me rage
Seems
today.
Like they should be asking everybody. Just 1 or 2 appointments, could really make a big lifelong difference. Instead, they're like, let's get you a bladder sling.
Right. No. Yes, exactly. And that's my other big thing is that I always tell docs, send them for an eval, send them for a one-time visit. So much so that my company, I actually got us to start offering screens for free to anyone who's had a baby exit their body. So we can just talk about let's check you for diastasis. Let's do an external pelvic floor check to see how you're doing here, address any back pain with feeding your baby concerns, and go from there. Maybe you need PT or maybe you don't. So we do that for the whole community. If you've had a baby exit your body, you can call us and schedule free for 30 minutes with with one of us to make sure. And then I can call the doctor to say, hey, can you send me a referral for this person because she had a 4th degree tear and she probably needs some PT.
Yeah, for the rest of her life.
Yes.
Well, I love that. And also, to your point about just you have different body mechanics post baby. I have so many people that are like, well, it's not really where the epidural was, but my back hurts after I have a baby. I'm like, that's because you lean funny when you're breastfeeding and the car seat. There's so much that just changes just how you live your life after a baby. What a great.
Absolutely. And those the cribs, the cribs are I'm all for putting babies in a crib and different crib heights, but I'm 5'3" and change, and to put my baby down at the very bottom of that crib, I was thinking about my body mechanics. I'm my toes are coming off the ground, to put them down, when they're at that full, however we want to call it, the depth of the crib. And then, asking people to pick up 30 to 40 pound potential to toddlers, from that level. Yeah, everything is different. That's not something I did on a routine basis before I had children.
Anyway, such a great conversation. So if you have played the Is This Normal game and I want you to make a promise to yourself to talk with your provider at your next appointment, or just Google it, see if you can just make an appointment, just pay a little cash and make an appointment to see a physical therapist. That might take out one of the roadblocks of seeing your GP.
Yes, absolutely.
Yeah. And oftentimes you don't even need a referral. Sometimes you do, sometimes you don't. Depends on your insurance. So I think it's worth your time. This has made me think maybe I should revisit. That awkward lady's still in California, so she won't find me in Phoenix. Maybe she's here. I don't know. But if I go in a room and she's there, I'm calling it quits.
I'll find you somebody better. It'll be okay.
All right. Thanks for coming on, Ashlie.
Absolutely. Thank you so much for having me.
Okay, guys, I hope you enjoyed that episode. And I especially enjoyed the is it normal section because I just think a lot of us think that this is just how our bodies have to age. I think our moms may have told us like that's normal. That's just how it's going to be. I think the always panty liners make a lot of money off of people, including myself, when we could be doing exercises that might just help it. And the panty liner's just there just in case. But there are things we can do to change. I have made a vow that I'm going to look for a physical therapist in my area and figure out a cash price and see how much it'd be to see them to maybe make a few changes. I probably am not going to do a ton of visits. I love the idea of telehealth, but I would encourage you to follow Ashlie on TikTok, on Instagram. She's Ashlie Crewe Campitella. I'll have all the links in the show notes. Just lots of good information about what's normal, what's not normal, what you can do. And especially if you are pregnant, there are things you can do towards the end. And especially after you have your baby, talking to a doctor about a physical therapist is such a good idea. I wish I had done that. I think it could save me big pain down the road. Two really quick housekeeping things. First off, the Pulling Curls podcast is going on its summer hiatus. Just 1 week. We will just take next week off, and then we will see you back here for season 3, which is moving to Tuesdays. So we will see you on July 27th, I think it is. Be sure to subscribe in your favorite podcast player so you do not miss an episode. We'll see you then. Thanks so much for joining us today. I hope we helped smooth out a few of the snarls in your life. We always appreciate it when you guys share and review. Until next time, we hope you have a tangle-free day.